What does informed consent for olanzapine, otherwise known as Zyprexa, look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And today we're going to talk about olanzapine, otherwise known as Zyprexa. So olanzapine is one of our most effective antipsychotics. There's even been recent literature to show that it might rival the efficacy of clozapine, which is our most powerful antipsychotic that we usually reserve for people who failed multiple other trials. So it can really work for people. Its uses are going to be primarily psychosis or used for bipolar disorder for either mood stabilization, treatment of mania, or even treatment of depression. It is also used off-label for treatment of certain eating disorders. It can help with appetite stimulation as well as treatment of mood and obsessive thoughts. And of course, it can also be used off-label for treatment of agitation. So in terms of side effects, I kind of break things into three clusters with the atypical antipsychotics. So the first one is going to be the risk of extrapyramidal symptoms. So this includes things like muscle rigidity, tremor, uncontrolled muscle contractions. This can include things like dystonias, where there is a sustained muscle contraction that you're unable to control. So torticollis is the sustained contraction of your neck muscles. There can be tardive dyskinesia, which is for people who've been on antipsychotics, usually for a period of time. They develop these uncontrolled movements around their face or their eyes or their hands. Then there can be Parkinsonian symptoms, which look like slowed gait, muscle rigidity, masked faces, tremor, and of course there's a risk of neuroleptic malignant syndrome. Now, because this is an atypical antipsychotic, it does have less strong of a D2 blockade, so these things are less likely than with the typical antipsychotics or the older ones like Haldol, Prolixin, etc. But olanzapine still does have quite the D2 blockade, so it definitely can happen with this medication. Cluster 2 of side effects is going to be those ones that are pretty common amongst most psychotropic medications, so things like headache, stomach upset, dizziness, fatigue, and drowsiness. And with olanzapine, similar to Seroquel, it is quite sedating. And then there's the last cluster of side effects that I'm going to talk about, which is the metabolic ones. And so this includes things like increase in appetite, weight gain, increases in your blood sugar and your cholesterol. And olanzapine, unfortunately, is going to be one of the worst offenders for this. For this reason, it's usually not my first choice, and especially in young individuals who are antipsychotic naive, meaning they haven't taken other antipsychotics. I try to do something a little lower risk first, but for some people, this is a really good option. Now, it does have a long-acting injectable form, meaning that someone can get an injection once a month and they don't have to take a pill every day. But the injectable version of this is almost never used because of a potential adverse effect of basically sudden death. So it requires you to be monitored for 4 to 8 hours after the injection. And so it's just not realistic. Just like any other atypical antipsychotic, it is going to require annual lab monitoring. So we're going to check your complete blood count, we're going to check your comprehensive metabolic panel, your lipid panel, and your hemoglobin A1C as a measure of your blood sugar. And this medication, similar to other atypical antipsychotics and antidepressants, can be really challenging to get off of. There's an increased risk of relapse of illness as well as withdrawal symptoms if you stop the medication abruptly. So if you're considering coming off of this medication, definitely work with your mental health provider to do so in a safe way. So of course, after talking about all of this, I'd answer their questions and we would determine a treatment plan based on shared decision making. If there's another medication that you want to hear the informed consent process for, then please put it in the comments below. I'm also getting together an email list for anyone who's interested in my content in case I have future offerings like resources or courses, and that way I can share them directly with you. So if you're interested, send me a DM with your email. I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.